Ever wondered why you or someone you know suddenly struggles to breathe even at rest? That's asthma for you. Asthma, in its simplest form, is a chronic condition that affects your airways, the tubes that carry air in and out of your lungs. Imagine walking through a narrow alley that's becoming increasingly constricted, and you're trying to carry a full breath of air through it. It's a bit like that. Our body is a wonder of engineering. When it functions smoothly, we hardly give it a second thought. But when something goes awry, it's like a wrench thrown in the works. With asthma, the airways become inflamed and swollen. The inflammation makes the airways extremely sensitive to irritations and increases their susceptibility to an allergic reaction. As the inflammation increases, the airways narrow down, making it difficult for air to pass through. The muscles around the airways tighten in a process called bronchospasm. And to make matters worse, the inflamed airways start producing excess mucus. This mucus clogs up the already narrowed airways, making it even more challenging for air to pass through. Now, let's get a little more specific. You see, the air you breathe travels down your throat and into a network of air passages that branch off into smaller and smaller tubes, ending in tiny sacs called alveoli. With asthma, these tiny tubes can become so narrow and clogged that oxygen has a hard time reaching your alveoli. This is why you might feel out of breath even when you're at rest. Asthma is a bit like an unseen enemy lurking in the shadows. It can lay dormant, causing no issues for days, weeks, or even months. But when it strikes, it can turn a simple task like breathing into an uphill battle. And the worst part? There's no cure. But don't lose hope just yet. While there's no cure, asthma can be managed effectively with the right treatment and lifestyle changes. So, that's the basic idea of what asthma is. A silent and unseen enemy that affects millions worldwide. Asthma doesn't just happen. Something triggers it. But what? Let's delve into the world of invisible triggers that can set off an asthma attack. These triggers are like hidden enemies, lurking around, waiting for the perfect moment to strike. But don't worry, they're not as elusive as they seem. First on the list, allergens. These are substances that cause allergies and can trigger an asthma attack. They can be anything from dust mites, pet dander, cockroaches, to even pollen. Picture this. You're enjoying a warm summer day and suddenly you're sneezing, wheezing, and struggling to breathe. That's pollen, a common allergen at work. Next, we have cold air. Yes, something as simple as a change in temperature can trigger an asthma attack. Imagine stepping outside on a chilly winter morning and your lungs suddenly tighten up. That's the cold air causing your airways to constrict. Now, let's talk about exercise. While it's beneficial for our overall health, for some people with asthma, it can be a trigger. It's not the exercise per se, but the fast-paced breathing during strenuous physical activity that can lead to an asthma attack. Lastly, we have stress. Life's pressures can take a toll not just on our mental health, but on our physical health too. Stress and strong emotions can cause an increase in breathing rate, which can, in turn, trigger an asthma attack. It's important to remember, though, that these triggers are not universal. What may trigger an attack in one person might not affect another. It's all about understanding your body and its reactions. So, keep a diary, note down when your asthma flares up. What were you doing? Where were you? What was the weather like? These clues will help you identify your personal triggers. Knowing your triggers is key to managing asthma. It's about understanding your body's reactions. By identifying and avoiding these triggers, you can take control of your asthma rather than letting it control you. Your body sends out distress signals when asthma strikes. Do you know what to look for? Let's talk about the common symptoms of asthma and how they manifest. When your airways get inflamed, your body reacts with a series of symptoms. These are your body's SOS messages, urging you to take action. Firstly, you may notice a persistent cough. This isn't your regular run-of-the-mill cough. It's an incessant dry cough that often worsens at night or early in the morning. It's your body's attempt to clear the airways to push out whatever is causing the irritation. Next, you might experience wheezing. This is a high-pitched, whistling sound that's most noticeable when you exhale. Imagine trying to breathe through a straw. That's what wheezing feels like. It's a sign that your airways are narrowing. Then there's the shortness of breath. It's a feeling of not getting enough air, a struggle to breathe. It's like being a fish out of water, gasping for every breath. This distress signal is often accompanied by an increased heart rate and a sense of anxiety. Lastly, your chest might feel tight, almost as if someone or something is squeezing it. This is due to the muscles around your airways tensing up, constricting the flow of air. Now, these symptoms can range from mild to severe. They may not be present all the time, and their intensity can vary from one person to another. You might experience all of these symptoms, or just one or two. Sometimes they might be so subtle that they're easy to ignore. But remember, even mild symptoms can be a sign of a serious problem. Knowing these symptoms is like knowing the enemy's strategy. It means you can act fast, take the necessary measures, and prevent a full-blown asthma attack. So, keep an eye out for these distress signals. They're your body's way of telling you that something is not right, that it's time to take action. Recognizing these symptoms means you can act fast and prevent an asthma attack. Having asthma doesn't mean you can't live a normal life. It's all about management. Let's dive deeper into the concept of asthma management, which in essence is your personal battle plan against this unseen enemy. The first and most crucial step in this plan is understanding the importance of a structured treatment plan. This typically involves working closely with your healthcare provider to understand what medication is best suited for your specific type of asthma. It could range from inhaled corticosteroids, long-acting beta agonists, to combination inhalers. Each serves a unique purpose, designed to either control symptoms on a day-to-day basis or to provide quick relief during an attack. But remember, medication alone can't win this battle. Regular checkups with your healthcare provider form a critical part of this plan. These visits allow your doctor to monitor your condition, adjust your medication if necessary, and provide you with the opportunity to ask any questions or discuss any concerns. Moving on, let's talk about lifestyle changes. This is where you can take charge and make a significant difference in managing your asthma. Understanding and avoiding your triggers is key. These triggers can be anything from dust mites, pollen, to even certain foods or exercise. By knowing what triggers your asthma and taking steps to avoid these triggers, you can significantly reduce the frequency and severity of your attacks. Lastly, maintaining good overall health can't be emphasized enough. A healthy body is more capable of warding off asthma symptoms. This includes a balanced diet, regular exercise within your capabilities, adequate sleep, and stress management. So, let's recap. Your battle plan against asthma involves a structured treatment plan, regular checkups with your healthcare provider, understanding and avoiding your triggers, and maintaining good overall health. It might seem like a lot, but remember, you're not alone in this battle. Your healthcare provider is your ally, ready to guide you and provide the necessary support. With the right battle plan, you can keep asthma under control. Asthma is more than just an individual's battle. It's a global concern. Asthma doesn't discriminate. It affects individuals of all ages, races, and backgrounds, from bustling cities to tranquil rural areas. Globally, hundreds of millions of people are grappling with this condition, and the numbers are growing. This invisible enemy doesn't just cause physical discomfort, it also has a profound impact on the quality of life, hindering day-to-day activities and creating constant worry. But there's hope. Researchers across the globe are tirelessly striving to better understand this complex condition, and their work has led to significant advancements in asthma treatment. These efforts have given us more effective medications, innovative management strategies, and a deeper understanding of how to prevent asthma attacks. The fight against asthma is a collective one. By raising awareness and supporting research, we can make a real difference. Together, we can raise awareness and improve the lives of those living with asthma.